everyone. I'm Dan Baden, and I'm here to talk about CDC's Health Game Jam 2013. This is a project that Peter Jenkins, Lee Willis, and I put together. We were trying to find ways to see if we could get more people with 21st century skills interested in public health. We also wanted to see if we could come up with inexpensive and rapidly developed innovative health education tools. We wanted to focus specifically on CDC's winnable battles, which are public health priorities that have large-scale impact and proven evidence of how to move forward and address them. So that's where we're aiming. We said, why not use a game jam? We wanted to have 100 or more people come together and work with, form teams, and work with CDC experts and industry experts to try and envision, design, and code working models of health games, all in one 48-hour period. We figured we'd give the winning team a paid 4-week internship at CDC afterwards to learn more, not to rest. So you may be asking yourself, why on earth should we be using games? Well, 58% of Americans play games. The average gamer is 30 years old. 45% of gamers are women. Women 18 and over actually outnumber boys 17 and younger. So it's a nice, broad demographic range that we can reach. But games? Let me give you a couple examples of how they have been used. Remission was a game that was developed by Hope Labs a couple years ago for cancer patients. They did a study and were able to prove that patients that played this game had a higher understanding of their disease, they had a higher level of self-efficacy, and a better adherence to their medical regime. A second example is Fold It, which was a puzzle game that AIDS scientists used to identify the 3D structure of an AIDS protein. The scientists have been working on the structure for 15 or so years. The gamers using Fold It solved the structure in 10 days. So games can be very powerful. We also have great partners in this area. The Robert Wood Johnson Foundation has worked in this area for 10 years. They host an annual Games for Health conference. They put a couple $1 million into health games research specifically. Additionally, the White House's Office for Science and Technology Policy has established the Federal Games Guild, which is a cross-governmental group looking at the use of games to address grand challenges. So we have great partnerships potentially out there. So what were our goals? We wanted to get 100 people to show up. We got 300 people to show up, the same weekend that Grand Theft Auto 5 came out. So if you know anything about that game, you know that these people actually chose to work on designing health games. This also led to us to be the largest game jam ever in the United States. Not Health Game Jam, Game Jam. So we have people interested. We also think we were the first federal game jam. We hope to get 12 demos made. We got 29. We hope to get people interested in public health. At the beginning of the event, only 5% of participants were interested in public health. 48 hours later, 50% were interested. So it's potentially effective. We also took your $10,000 and capitalized it for an additional $19,000 from external sources through direct donations and in-kind. So what did we actually get? We got a lot of good demos. We got nutrition games, heart disease games, injury prevention, including texting and driving. We got HIV, teen pregnancy games. A lot of these hit CDC's winnable battles. So a lot of good games. The winning game was one called Kitchen Outbreak, which focused on hand hygiene, not cross-contaminating your working surfaces, and cooking food at the right temperature. Our insights from this effort were that there's a lot of partners interested in this area. We found them all over the place. And a lot of others were looking at what we were doing to see how they could capitalize on it. In fact, the White House's Federal Games Guild is actually, at least in part based on our success, looking at having their own event in the near future, their own game jam. Additionally, we found subject matter experts who were happy to participate. We got 14 to come out on a Saturday and work with us. We found that free admission was critical. In the past, or typically, you have charge for people to join game jams, and we were able to have them participate. I'm moving faster. We feel that we've demonstrated that game jams can get people interested in public health and that we can get them to rapidly develop games. The next step is to host the 2014 Game Jam. We've proven that we can get games made this way. We don't know the quality of the games. That's the next focus, evaluating the quality of these games, both for knowledge transfer and behavioral change. Thank you.
Thank you very much.
Well, I was going to go to the evaluation question right away, of course.
All right.
And the other is, and I know it's a little early since they have not been developed and they haven't been evaluated, but what's the long-term vision in terms of the dissemination of these? So if we do come up with one that is effective, either in knowledge transfer or actual behavioral change, then what?
Okay, a couple great examples. There was actually a study that was just done on a game like this. It came out last week in the American Heart Association Journal. It was focused on letting kids 9 or 10 years old play a game about stroke. They were able to demonstrate knowledge retention 7 weeks down the road. So we can teach people. We also have a game at CDC, or a motion comic at CDC, where we're able to teach people about STDs and HIV, things along that line. They've been able to demonstrate knowledge retention 3 months down the line. Another one is Play Forward, which it's still in preliminary phases, but again, youth risk behaviors. They've been able to show that there's knowledge retention 3 months down the line, as well as behavioral change intent. So those are examples of the tools we can use. But regarding evaluation, all of those are looking at efficacy in a controlled setting. We need to evaluate these in the real world settings. So we need to find partnerships to be able to do that. I don't know that that's appropriate for the next step with $50,000, but we can build the partnerships as we move forward through these consecutive game jams. If we partner with the Federal Games Guild, which has cross-governmental reach, we have high-level interest. They can help us leverage partners in the academic setting. So the long-range goal would be test some games, demonstrate, build the body of evidence, and then scale them up through we have fabulous distribution networks through CDC, through all the health departments, through all the schools in the country, wonderful ways to get games out there. We don't have to charge for these, so people will be willing to play. And the American Heart Association study, they demonstrated that people who went back and played the game more than 15 minutes had some improvement, but not dramatically improved. So we don't have to get their attention for 15, 20, 30 hours. If we can get our attention for a short period of time, we can still have impact.
So is your, I guess the business model could be that games would be replacements of existing, less impactful training materials?
Yes.
So as a next step, can you bring in a partner who maybe at the CDC who's also like building training materials, that they would direct some of that funding to leverage some of the additional funding?
Definitely, that would be a possibility.
I would also suggest maybe building a smoking cessation game for the Indian health people. That would be a good collaboration there.
That'd be great.
That's a great segue into my question, which was you had about 12 different topics for games that you listed, but it looked like wellness and nutrition were the most popular. Did you kind of glean any insight into particular areas that were particularly well suited for games? In terms, you mentioned some examples earlier with remission and others. Anything that you're starting to see?
We didn't control anything that the team worked on. We didn't even force them to work on a health-related game. One of our early metrics was hoping that 90% would work on health games, but everyone wanted to work on health games, so that was great. So specific topics, though, they worked on nutrition, they worked on wellness. Wellness was kind of a nebulous topic. A lot of them were life cycle games where you're exposed to a lot of risks. You're at a party. Do you drink? Do you smoke? Do you engage in more risky behaviors? So, and then going across the entire life. What do you do when you're middle-aged? What do you do when you're older? So I don't know about specific topics at all audiences, but there are definitely topics that reach specific audiences.